You don't think about it until it's gone. Normal, pain-free walking is just a part of life, and it's something all of us take for granted, until the very act of taking a step can be a truly painful experience. To those with an active lifestyle, knee pain can be especially discouraging. It can literally restrict almost everything you do. In recent years, there's been a form of relief for hundreds of thousands of patients with knee pain, the procedure commonly known as total knee replacement. A less invasive and simpler procedure called partial knee replacement may be an option for many who suffer from painful, debilitating arthritis. Let's begin with an overview of the knee. The X-ray you see is that of a normal knee joint. It consists of the femur or thigh bone, the tibia or shin bone, the patella or kneecap, and cartilage. Notice that there's a gap between the femur and the tibia. This gap indicates the presence of cartilage. The cartilage serves as a cushion for the weight-bearing forces of the knee. Once degenerative arthritis sets in, the cartilage in your joints begins to wear away over time, until ultimately you have raw bone rubbing on raw bone. Hence, as you're well aware, the crippling pain begins. This X-ray shows a knee joint plagued with arthritis. Notice that there's no longer a gap between the femur and the tibia, as was apparent in the previous X-ray. Many physicians prefer these X-rays be taken standing up, so the joint is shown in a weight-bearing position, as it usually is when you're walking or standing. In this way, the physician can better determine the amount of cartilage remaining between the bones. You and your doctor may then discuss the specifics of your case, whether you may be a candidate for partial knee replacement, as well as the relative benefits and risks of the surgery. Once a person is diagnosed, issues such as lab tests, admission procedures, anesthesia, as well as pre- and post-surgery costs should be discussed. Your doctor and his staff will cover these issues with you. Partial knee replacement surgery may allow qualified patients to avoid a 3 or 4 day hospital stay and the relative lengthy rehabilitation usually associated with total knee replacement. Partial knee replacement typically requires an overnight hospital stay and may not even require physical therapy. A few gentle exercises and walking may be the only rehabilitation needed. What makes partial knee replacement surgery truly unique is that it allows the surgeon to treat only the diseased area of the knee, keeping healthy areas intact. Unlike total knee replacement, the patient retains a larger portion of his or her own knee. What happens during a partial knee replacement is that the deteriorated cartilage between the tibia and femur is replaced. Patients who have disease restricted to one side of the knee are typically candidates for this procedure. Special implants, like the ES unicondylar knee system from Halmedica Osteonics, were developed with patient needs in mind. Because a partial knee implant is smaller than a total knee implant, the surgical incision can be significantly smaller. A partial knee implant consists of a metal component that is attached to the femur and a plastic cap made of polyethylene that covers the worn area of the tibia. Once the two parts are in place, metal rubs on plastic instead of bone on bone, alleviating the source of your pain. For those patients who are candidates for partial knee replacement, there are potential advantages when compared to total knee replacement. As mentioned, the procedure generally requires a short overnight hospital stay and a smaller surgical incision. Because most of the knee joint is unaffected and the basic knee structure remains intact, postoperative pain, blood loss, and recovery time are typically reduced. The main concern of anyone facing surgery is the risk of complications. You'll be happy to know that complications after partial knee replacement are generally rare. However, because no surgery is risk-free, let's discuss some possibilities that may exist. Infection is always a risk with any surgical procedure. Complications that are extremely rare in occurrence but must be mentioned include implant malalignment, fractures, implant breakage, blood clots, and nerve or blood vessel damage. Your surgeon will be taking great care to reduce the risk of all of these complications. But please discuss all questions about potential complications with your doctor. Lab work will be performed to check your health condition before surgery is seriously considered. This lab work detects conditions such as heart disease, high blood pressure, and diabetes that need to be taken into account in planning your pre- and post-surgical care. Following surgery comes the recovery period. Recovery time varies from person to person. However, many patients undergoing partial knee replacement return home from the hospital the day after surgery. They may be driving a car in 2 weeks and dancing and golfing around the 6th week after surgery. It's important to note that participating in high-impact activities like tennis and jogging may be limited due to the pressures they place on your knee. Please discuss your specific activity concerns with your doctor. We know the decision to undergo partial knee replacement is an important one that you and your doctor have to make together. We hope that this presentation has helped you gain a better understanding on which to base your decision.
I hope we've answered most of your questions regarding hip replacement surgery. One last point. The success rate of this operation approaches 95%, so making the decision to proceed with the surgery may give you many years of pain-free activity, and perhaps even a new lease on life. And again, if you have any questions or comments, please don't hesitate to ask your doctor.